All right. So, the good news is you're in the right office and I'm going to be able to help you. So after I looked at your x-rays and your exam yesterday, I want to go through this report and I'm going to give you this to take home with you. And so, you're a smart girl, I'm not going to read this to you, but I do want to point out some facts. And I know you've had a little bit of experience with chiropractic in the past, but chiropractic has been around for 150 years. So had it not worked so well, it would have disappeared a long time ago.
Right.
And in fact, the opposite is true. We're now the second largest healing profession in the world. And there was a study done by WebMD, and they found that there was a 95% satisfaction rate when chiropractic was used. We're 99% confident we can help you, or we wouldn't accept you as a patient. And I love this fact because they were actually trying to prove that chiropractic didn't work. So I love bragging that there was that high of a success rate.
I believe it.
So now, the million-dollar question, why do you feel the way that you do? Everybody wants to know that. And the answer is, it's the accumulation of trauma through your entire lifetime, as early as birth until now.
Gee.
So if you think about when you're born, you know how you come out, especially if you were born vaginally with forceps or if you're pulled. And then you add to that your toddler years where you're walking, you're falling, you're jumping off stuff. Teenage years, sports, car accidents, and then as your adult lifestyle sets in, you know, you're a nurse and you're doing admin work at a desk 8 hours a day, stress, driving, phones, and even if we eat extremely healthy, we still have different things in our food now that we didn't have before. So all those things can create subluxations, which I'll explain in just a minute, and therefore pain. So in your case, you've got nerve damage. Now, you can't have pain without nerve damage. So especially headaches, neck pain, low back pain, those are the areas where you've got nerve damage. And you'll find it interesting to know that your brain communicates to your body through the brain and the spinal cord.
I was looking at that yesterday, looking at some of the stuff. I was like, okay, that explains, because like my ear hurts sometimes, and then I get the headaches. I was like, oh.
Now, how interesting is it that you've got about 740 trillion nerves in your body?
Goodness.
And so only about a third of those have nociceptors or pain fibers. And so by the time you have pain, you've probably had decreased function wherever that nerve travels long before the pain set on.
Wow.
So pain's going to be the last thing to show up and the first thing to leave. As a protective mechanism, your muscles tighten around that area and form spasms. And so you've got some tightness in your muscles up here in your traps and also in your low back. You've got some permanent tissue damage, which I'm going to point out at your x-ray, and that's at L5S1. So I can't reverse that, but I can start to reverse up here in your neck. You have a reverse curve. We're going to start to change that. And you've got major twisting in your pelvis, so we can start to change that as well. Spinal wear and tear again at the L5S1, and then you have decreased range of motion in your back. So those are the things that we need to do in order to get you feeling better and functioning better. Okay?
Wow.
So the next page here, I'm going to steal this for 1 second. The clinical term for what we treat is a subluxation. A subluxation means that there's joints that are not working correctly, and it causes interference on the nerve, and then you're going to have pain or decreased function wherever that nerve travels. And so if you can imagine, for instance, watering your garden, if you get a kink in your hose, what happens to the water?
It stops flowing.
Stops flowing. So same thing, when your brain's trying to get messaging out to your body, it stops flowing. And so we grade degeneration in phases, just like heart disease or cancer, something you might be more familiar with. The further you are in this phase of care, the harder or more complicated your case may be. And actually in phase 4, you may be a surgical candidate. So right now we have you rated phase 2, and we want to move you back towards phase 1 as quickly as possible. Okay? If you want to flip the page over to your x-rays here, I'm going to show you your films, and then so this is your neck when viewed from the front, and these are your vertebrae, and these dark spaces are your disc. And really from the front view, I really like how your neck looks. I don't have any problem with it. The side view here is a little more interesting. So your neck should be curved like a C. And right here at 3, 4, so see 1, 2, 3, and 4, you start to reverse your curve. That's the reason you're getting your neck pain, your headaches, and your trap tightness.
Wow.
So as we can start to realign you, all of that's going to go away. Okay? Does that make sense to you?
Yeah.
The side view of your low back, these are the bones, these are the vertebrae, these are the bones of the vertebrae, these are the disc space, and L5S1 has a very mild disc space thinning back here at the back. Can you see that? So this is a normal disc right here. And you can get up if you want to stand up. This is a normal disc. These are the holes where your nerves come out. And this one's a little thinner. And so it's irritating this nerve, and that's why you're having your low back pain. Now for the most interesting one, this is your back when viewed from the front. And so I did a bunch of measurements here, but long story short, you can see that it towers off to the left.
Yep.
And so I want to find out why. And the answer is you have pelvic distortion and you have a leg length deficiency. So when I look at your pelvis here, you measure 60 millimeters on the left side and 80 on the right. Your pelvis is so twisted. Let me show you on this. So your pelvis is not really that one bone shorter than the other. It's twisted. And when that happens, these SI joints, which have the most nociceptors or pain fibers in all the body, get really inflamed and irritated. And so, and then also the pinching of the low back, one side opens up where the nerve comes out, but the other side pinches off. So you've got kind of a double whammy here. So I'm going to give you some recommendations as far as support to your chiropractic care. And when we look down here, I always try to find out, why. Why is the why do you have distortion in the pelvis? And when we look down here, your left leg is 11.5 millimeters shorter than your right. And so in order to support your chiropractic care, I'm going to suggest that we get a little heel lift. That's okay. It's inexpensive. And this is, like, you did such a great job for getting in here. So none of this is scary because it's all fixable right now. And only on that one little disc space, that L5S1, is that the permanent, but it's very mild. So I feel like we can still help you 100%. Okay, this is kind of the ugly part, and then I'm going to get to how we're going to be able to help you and how we're going to be able to support the chiropractic with the heel lift so that you don't need as long as a treatment plan. Because what would happen is if I adjusted you on the table and you stood up on this 11 millimeter difference, you would go right back to where you are now. And so we're going to do this heel lift, and then I'll re-x-ray you in 6 months and see if you still need it. Because 1% of my cases are structural, meaning you literally have a short leg, but 99% of them are functional. And I think that's you because of your pelvis. So I think the twisting of your pelvis has pulled that leg up. And so what I need to do is realign your bones, and then that support will make your muscles change as you walk around every day. And then, after 8-12 weeks, your muscles are going to shorten in some places and lengthen in others. And then we'll re-x-ray and see if you still need that size heel lift or maybe none at all. Okay, so it's really exciting stuff, actually, because you came in at the right time and you're in the right place. Imagine if you would have waited 10 years, okay? And so we're in a good place, believe me, okay? Just trust me. Trust me for a minute. All right, girl. So since I can't give you those x-rays to take home, I am going to circle here some of the areas that I was just a little bit concerned about. And it's C3, C4, and down here at L5S1, okay? So you can see that your neck looks a little bit more like this than it does this nice C curve. We want it to look like that C curve, okay?
Yeah.
Any questions on your x-rays?
No.
Okay. So, just like you didn't get this way in a day, we're not going to fix you in a day either. But I try to paint. So what we're going to do is a series of treatments called adjustments, and that's where I start to realign your spine. And then I try to paint, I break your treatment up into 3 stages: pain relief, stabilization, and then maintenance. And I try to paint the ugliest picture back here because I like to be a hero when we get you better faster, okay? But what I think you're going to need to get rid of 80% or more of your pain, which is the stage 1, is to see you daily for 1 week and then 3 times a week for 1 week, okay? During that time, I'm also going to get you a heel lift that's going to stabilize your adjustments, so your adjustment's going to hold longer. If we didn't have that nice heel lift, then it may be 3 times a week for 3 months before we could get you stable and get that pain gone. After that, we're going to enter into the stabilization. So assuming you've got 80% of your pain reduction in pain, we're going to move to the second phase of care, which is stabilization. I think that we're going to need twice a week for about 4 weeks, okay? By the end of this phase of care, you should have no pain and you should be functioning optimally, okay? Then we need to start to correct and change this pelvis. And so we're looking at once a week for 4 weeks, and then we'll space you out from there. My guess is that your maintenance is gonna fall somewhere within the range of twice a month until we re-x-ray you. Okay? So, I do re-exams every 6 visits. If you're doing extremely well, we'll decrease the frequency of your care earlier. And, if you're not where I expect you to be, then we may add a visit or 2. If you decide to become a patient here, then there's a couple of things that I need from you. One is come to our How to Stay Young class. All of our new patients come to it. It's 15 minutes, it's free. It gives you tons of information, and I find when patients attend that, they end up having a shorter treatment plan because you know how to live outside of here. So we give that Wednesdays at 12:30 and Thursdays at 6:30. Which one of those works better for you? Neither?
I can't.
So I'm going to make a note to have the girls give it to you individually.
Yeah, because I work 12 to 8:30.
Okay. And we can do it individually, it's not a problem, okay? And then, I don't want to add this in now, but I want you to know that we do acupuncture. If you're still having your migraines after the first couple of weeks of chiropractic, we'll discuss it then. And then that 7mm heel lift. Now your insurance won't cover it, but it's only $20, and I think it will save you a ton of visits.
They never cover anything. Well, I take that back. I'm grateful to have insurance.
Yeah,
certain things.
exactly.
But that's not bad.
And then I also said that I would talk to you about the weight loss program overview, which we can do in just a minute. But I just went over so much information. I want to see if you have questions about what's wrong, what I can do to help, or what your treatment plan is.
Okay, stage 1. Does this correspond to the phase that's in here? Or is
Nope.
this different?
This is different. This is your treatment
The
plan.
okay.
So this is pain relief,
Okay.
and then we're going to stabilize, and then we're going to start to push you to maintenance. Maintenance is the most important because that's where we really start to change that pelvis.
Okay.
Because see, I can't really change the pelvis in 6 to 9 visits, which is probably where you're going to see the most amount of reduction in your pain.
Okay. So we start here, and this is that 1 hour?
Once a week, daily for 1 week, 3 times a week for 1 week.
Okay.
So your pain relief phase is going to last 2 weeks.
So come to you for 2 combined.
Yeah.
These 2 for 2 weeks every day.
Mm-hmm.
5 days.
No,
A week. No.
the first week daily,
Okay.
and the second week 3
3
times.
times a week.
Mm-hmm.
Okay. That's the only. This part here. As long as it's before I can go to work, like now, it's fine because I live right down the street, which is fine. I come in here and get ready and go change my clothes or whatever because this is when I'm going to work. Fine, you know what I mean? This is fine. But the issue is my insurance. How I need to find out what they're going to cover.
Yeah.
And how much is it going to be
Mhm.
for me to come to you.
Good
every day.
question. And Mandy will go over all of your insurance
Okay.
and finances with you.
Okay.
She'll also get you scheduled out for treatment.
Okay.
If something happens and you can't make daily, we'll be extremely flexible. We have lots of payment options.
Okay.
But if you can't make daily because of work schedule or whatever the case may be, she will work out the closest fit to my recommendations that you can do.
Okay.
And then she'll tell me what that is, and then I'll give you expectations. So, or what you can assume your expectations can be with care. So for example, if I expect you to be out of pain in 2 weeks under this care, but you can only start 3 times a week, then it might take us 3 weeks to get the reduction in pain that I expect.
Okay.
But that's okay, and we'll do re-exams every 6 visits, just like I said. You'll have questions come up as we go along. It's a lot of information to swallow in 1 visit.
What's involved in a re-exam? Is that kind of like what we did yesterday?
Yeah.
Okay.
It's a quickened version of that.
Okay.
Yeah. Any questions for me just on your treatment plan or what's wrong with you?
Well, like, why is this happening? No. 'Cause,
Okay.
I mean, I guess gradual, like you said, over time, stuff just shifts, gets out of whack.
It's the accumulation of trauma through your entire lifetime, and that's what so many people, everybody wants to know, how did I get this way, and that's the answer. So, all right, well, let's get you started with your adjustment, and then after your adjustment, Mandy will put you on the muscle stim, which you had yesterday.
Yeah.
She'll go over all of your insurance. She'll get you a heel lift, and we'll get you scheduled out. Sound good?
Yeah.
I'm so excited to have you. You're in good hands. We're going to be able to help you, okay?
Okay.
All right, Nikki, come on with me.